Dr. Adam Peterson from Skyline Animal Hospital in Idaho Falls, and I'd like to spend a few minutes today talking about canine dental disease, periodontal disease that we see in the dogs that walk through our doors as pets. We find that an amazing number of dogs have periodontal disease, okay? As many as 70 or 80% will show some dental disease starting by 2 years old, and that number just increases every year we go along, to the point where 5-year-olds, most of them, unless something's been done about it, have some amount of dental disease or periodontal disease. Okay, so when I say dental disease, what I'm talking about, first it starts with some plaque and some tartar on the teeth. It's not long before that progresses to gingivitis and to periodontal disease. The problem with gingivitis and periodontal disease is once that inflammation starts, we get into a situation where all of the garbage that's in the mouth can start to get into the bloodstream, and somebody's got to deal with that. So I have an example here. I had a 7-year-old poodle that came into my exam room and hadn't had anything done with its teeth and hadn't seen a vet in 3 years. Walked in with 22 teeth and it walked out with 0. Now the real problem here is everything that's going on surrounding those teeth. What we run into is all the garbage and all that plaque and that tartar and the bacteria that's in the mouth can start to get into the bloodstream. And once it does, the body's got to deal with that. So it's not about stinky breath, it's not about white teeth, it's truly about overall health. So once that stuff, once dental disease is going on and gingivitis and that starts to get in there, the liver, the kidneys, they need to deal with what's going on in the blood, and that's hard on those organs. Heart can be affected, lungs can be affected, and truly dental disease is one of those things that can shorten life. So the question is, what do we do about it? What are the recommendations? Well, if we look to the American Veterinary Dental Society, the recommendation is that any small dog, and that's usually most dogs under about 20 pounds, they would benefit from a dental by 3 years old. Okay, and when I'm talking about a dental, I'm talking about full anesthesia. I'm talking about cleaning those teeth, taking care of the periodontal disease, polishing those teeth, full exam by a veterinarian, and extracting any teeth that need it, that are causing any problems. By 5 years old, the vast majority of dogs will benefit from a first dental, and truly after that, it's recommended small dog, big dog, the vast majority of dogs need a yearly dental. They need a dental every single year to take care of that problem, so that their liver and their kidneys and the rest of their body is not having to deal with all that garbage. You and I go to the vet we go to the dentist twice a year, and we brush our teeth 700 times a year. These guys don't brush once. So that's what's recommended. If you have a dog, I would recommend that you spend some time talking to your veterinarian about dental disease, because if he doesn't have dental disease, he or she doesn't have dental disease yet, they sure will, and this is a way to lengthen their life. So I appreciate it, and just encourage you to do that.